Okay, so good afternoon and welcome everybody to the ExChange Autumn Conference series, Safeguarding Approaches for Criminally Exploited Children. For those of you who are joining for the first time, the conference series began on the 1st of October. We're delighted that Dawn Bowden, the Minister for Children and Social Care in Wales, opened our conference, and her video address can be found on the ExChange website. So to date, the conference series has included webinars on the multi-agency approaches to criminally exploited children by myself, and strengthening the system for criminally exploited children by Sharon McKeever, who is Criminal Exploitation Director for Action for Children. We have an interview with the Grand Ambitions team who produced the play Hot Chicks, which was set in Wales and tells a story about grooming and exploitation of young girls, and a podcast about transitional safeguarding from Finn Medell, who is Safeguarding Service Manager for Newport City Council, speaking to Steve Bagley from NWG. So all of these sessions will remain on the ExChange website for you to look at. And as well as today's webinar, we have one more. We missed next week because it's half term. So the last webinar is by Sarah Goff on the 4th of November. And Sarah's a researcher from Manchester Metropolitan University. And she's going to be talking about the exploitation of learning disabled and neurodivergent children. But today, we're delighted to welcome Paul Andell, who is an Assistant Professor of Criminology at the University of Suffolk. Paul's work's been recognised by the American Society of Criminology because it has real-world impact. And his research includes the co-produced National Lived Experience Training on Child Criminal Exploitation, which he developed in partnership with the National County Lines Coordination Centre. So the format for this session is around a 40-minute presentation, followed by around 20 minutes of question and answers. So we invite you to post your questions into the chat box as we go along, and then I'll try and ask Paul as many questions as we've got time for at the end. So over to you, Paul.
Well, first thing I'd like to say is Prynwyn Da, and good afternoon. What I'd like to do today is to present a piece of work that will be published in April, I believe, and it involves some reflections on my own past practice as a social worker. Well, actually as an unqualified social worker then in residential care, and how those kind of reflections may or may not have changed since 88, I think it was, when I reflected back to, and how that impacts now in terms of child criminal exploitation, and how we might frame the care experience as sometimes, unfortunately, structural harms which are exacerbating to the needs and vulnerabilities of young people. So ideas and themes about structural violence is what the chapter is about. And I'll start, if you change the slide, please. I'll start by really, that's where it's going to be published. And if we move on again, the chapter is called Missing and Lost. And I guess it is informed by practice memories. And those experiences really make me think about what I'm doing in research. It never actually leaves me, practice days. And I've had several roles, including work with vulnerable young people who have been criminally exploited in more recent years. I managed the gang exit project in Brixton. And then subsequently, I've spent about 15 years researching vulnerable young people who have been drawn into criminal exploitation. And this presentation is really focusing down on missing young people from care, who's unfortunately sometimes become structurally lost. So it's about theory and practice, as we call it, praxis. And my kind of take on this is that practice informs and quite rightly interrupts more distant research. And what I've been trying to do with my own is to inform a kind of action research which co-produces ideas with young people, with practitioners, with policymakers, in order to make some palpable impact. And they remind me of what criminology, because I'm a criminologist, is about, and what kinds of criminology matters. And as Alvin Goldner said in 1973, that it's our job to uncover the structural deficits which underpin the observed behaviors, what we see in crime and deviance. So maybe this is my attempt to do so. So if we move to the next slide, please. So methodology for this study really is in three parts. It's something about a narrative of my practice and my memories of a young woman who went missing, and my search for her in a rather unloved tower block, and the kinds of structural issues which underpinned not her agency to disappear, but the responses that were or were not there when she did disappear. And I've kind of looked at this with, and I'm sure you're all avid readers of community care. And there's a column, isn't there, in community care, called Davy Jones. I don't know if you've seen it. And I think it's various authors that write about practice under this pseudonym of Davy Jones. And Davy Jones wrote something quite interesting about residential care in 2016. And then I returned to some of the qualitative findings from my own research in 2023. And that particular stint of research was in 3 different sites. And I wanted to explore longitudinally, really, if the kind of concerns and responses, and to put it more simply, to explore if there'd been any changes for young people missing from care. And what I hope to do by writing and publishing this chapter is to highlight persistent vulnerabilities of looked after children, and in particular in relation to the current threats of criminal exploitation, and sometimes the systemic failings of care provision. So if we have the next slide, please. If I start with some kind of dramatic statistics about child deaths, you'll see that there's, in the period that was studied from the Care Leavers Association, there was 400 deaths in regulated placements and 50 in unregulated. So as compared with the general population, that's kind of 16 times higher than the national average. And unregulated, what do we mean by that? Well, usually older children, bedsits, hostels, caravans, boats, shared houses, for which there's no consistent adult supervision. And In England, it was banned unregulated care for under 16, but still legal for 16 and 17-year-olds. If you move to the next slide, please. So there's been lots of campaigns around this, and Caroline Willow talks about those figures being shocking and saying that families don't stop caring for children at 16, neither should we. And of course, things move on since those statistics were produced. And the UK government now plans to end unregulated provision and also to introduce Ofsted registration and 3-year inspections. However, there's still ongoing concerns, and those ongoing concerns are around missing and sometimes I would say lost. And there's something about the infrequency of inspections and the inconsistency of standards which allow those conditions to perpetuate. And also, on top of this, the persistent risk of child criminal exploitation and neglect. So there's some calls for universal standards, annual inspections, and greater accountability. So if you move to the next slide, please. In the midst of this, there is some good news, and Wales is pioneering the way with new regs, with the Health and Social Care Act 2025, which I believe was passed in April, and will mostly come into force next April. And this act, as you all probably know, restricts the extraction of profit by providers of care. And this collectively is known as restricted children's services. So CICs will be still in play, so community interest companies, but there'll also be inspections, a greater inspection regime in Wales at the moment. And I think the English government are taking, or were taking, evidence for the new I think it was an education committee, all-party committee that were taking evidence for similar reasons, I would imagine. So to the next slide, please. So my interest in child criminal exploitation, of which I think in terms of child criminal exploitation, county lines, according to the statistics, is probably the largest form of child criminal exploitation, not counting CSE, but child criminal exploitation. If we talk about organised begging, if we talk about forced labour and so on, county lines, as we know it, the coercion for children to store drugs, money, transport drugs, weapons, and so forth by the use of technology, mobile phones, sometimes out of area, sometimes in area, and we'll talk about that in a moment, is the largest form of child criminal exploitation. And my research over the last 15 years has been concerned with this. And what I found and what's explained in that shameless advertisement for an early book was that there were policy pendulums that looked at the nature and existence of gangs. Do they exist? Do they not exist? How are they? What are the exploitative relations within gangs? How are they linked to the middle markets of drug distribution and so on? So we've had the policy pendulums of gang denial, then gang blame, everybody's in a gang. And now, thankfully, we've got to a place within policy research and hopefully practice that we having what's known, I think, as a vulnerability turn. We're starting to recognize victimhood and vulnerability within this space. And what I'd like to do is to examine some of these concerns of CCE and missing children through the lens of vulnerability, through cultural capital, and through structural violence. So the focus is on vulnerability, safeguarding, failures, and indeed improvements, and criminal exploitation. So what I hope to do is promote a little bit of discussion by introducing a different lens, if you like, to view an issue which I'm sure you are all familiar with. And hopefully this will promote discussions about accountabilities, really. Could I have the next slide, please? So these terms are bandied about: cultural capital and structural violence. So lost is more than missing. It's about children who disappear within a system whose needs are erased, if you like, by state and private systems of care, and the structural violence that accompanies this. This is a violence, if you like, which is about not having needs provided for, oppressions embedded within institutions where young people's behaviours are perhaps seen as defiant and not as resulting from trauma. And Bourdieu shows how exclusion from valued forms of capital deepens marginalisation. So young people who become involved in criminal exploitation generally search for two forms of capital, and Morse and Anderson write about this, and that's they join with others for a sense of belonging, bonding capital, if you like. And criminal exploitation networks or gangs are very good at providing bonding capital, a sense of belonging. But what they're not so good at is providing bridging capital, because the needs of young people have been described in the literature as has been a search for respect in many cases, whereby social exclusion have diminished the potential life chances for becoming accepted within the legitimate economy, within legitimate networks of care and love. And at the same time, as there's social exclusions going on, there is an over cultural inclusion into conspicuous consumerism. The new trainers, the new t-shirts, the goods that we all value, actually. So this tension between social exclusion and an over cultural inclusion. And Skeggs talks about how ideas of social capital are often marginalized in more excluded communities. They're often people's legitimate capital, social capital, is morally disqualified, often by professionals. And Marshall writes about this in terms of professional misrecognition within the youth justice system, for example. So when a child's actions of going missing, which may be a rational, the use of rational agency to negotiate a difficult geography to escape bullying in residential care or so forth, it's often viewed through a different lens, if you like, and this can be classed, raced, and gendered in those kinds of terms. And I'll explain a little bit more about what I mean about that in a moment. But the lens of social capital really helps us to explain why children in care are frequently misrecognised. They're seen as culpable rather than vulnerable often. And this is some of the themes that I'd like to explore today. So can we move to the next slide, please? So if we look at reports of missing, it's usually the largest proportion is children, and there is a disproportionate number of missing reports from care settings. And what we tend to do, not for the search for best practice, but by marketization or market forces driven, we look for out of area placements because capacity may be not available in one area, or a particular type of provision might not be available everywhere. So we then look for out of area placements, which heightens vulnerability, which sometimes increases missing episodes. And if you move to the next slide, please. And the police in 70% of areas think that out of area placements lead or are linked actually to exploitation. And what the Howard League says is that 81% of children that are criminalized in care have gone missing, have a history of missing episodes. And what I am suggesting is that missing episodes can sometimes signal structural neglect, really. That and by using this lens, this framework, if you like, it challenges sometimes the over individualization of children who are viewed as making entrepreneurial choices as rational agents to be part of illicit economies. And we all want to support children's agencies, but there are tensions in how we view agency and how we view free will, if you like. And by overemphasizing entrepreneurial choices in illicit economies, what we do is we obscure the systemic and cultural harms that are experienced by children, and particularly in care. And what my research over the last 15 years has kind of consistently said is that child criminal exploitation is often manifested through fragmented safeguarding. And this is not the fault of committed professionals often. This is kind of structural issues whereby the focus is on lists of risk rather than relational time to have relational care, to build consistent relationships with young people. So procedural compliance over relational care really is the kind of a main systemic failure in my view. So if you move to the next slide, please. So we've talked a little bit about county lines and what the National Police Chiefs Council defines county lines as is organised exploitation networks. It's children who, as you know, are now recognised, coerced into drug transport and money handling. When I started the research into this area, often children were just prosecuted for possession with intent to supply. Um, this form of abuse was not recognized, extrafamiliar abuse was not recognized. There was lots of arguments in academia about what is real, what is not real. But what was certainly real was the harms and sadly, sometimes deaths of children who were involved in this kind of world of exploitation and drug distribution. So in time, we've gradually recognized the problem, or we are on a trajectory in problem recognition, perhaps not always as early as we should. And the use of the Modern Slavery Act has been increased for Section 45 defences, criminal exploit, for human trafficking, and referrals to the national referral mechanism as a form of statutory defence. But I don't want to get into those legal debates. Perhaps we could pick those up in the Q&A. If we move to the next slide, please. So structural violence, as I'm terming this, in care institutions. What Brody and Pearce has been writing about in their work, primarily with child sexual exploitation, was that care environments can perpetuate violence, and that poor training and oversight can re-traumatize children. As I recall, back in the 80s, there was something called a CSS, where you could qualify as a social worker while you were on the job, as it were. I don't know what kinds of in-house training takes place, but I'm sure that there are opportunities for further reflections with increasing technology and the use of AI, online courses, and so forth. Perhaps that's a potential that we need to explore. But the forms of institutional neglect that I reflect on is that why do we have our most vulnerable children looked after by our least qualified people? And if you compare England and Wales with Norway, where perhaps families are taken into care, and you might think that that's a bit too much in terms of state intervention. However, the outcomes for those young people in care, certainly in terms of education qualifications, they are markedly higher than the general population. So there is something about interventions, the right form of interventions, which can be positive for young people and their life chances. But in 2019, Quorum Fields Children's Rights Legal Centre suggest that fewer than half of all missing children in 2019 received a return home interview. So nobody was asking really where the children had gone to. It was assumed that they were making rational choices to do what they wanted to do. So this kind of fragmentation, what I suggest in the book chapter is that it's continuous. There's still fragmented interagency safeguarding, and this poses significant challenges, particularly for children in care. And if you move to the next slide, please. So if we start to look at missing episodes as systemic harm, and of course, there's always a combination of individual agency, what it means to the child, and to the professional's culture, if you like, as well as the structural aspects of perhaps undertrained staff, perhaps resources that we're able to give to our most vulnerable children. So structure, culture, and agency. Children, these kinds of harms occur, and children go missing, sometimes to escape unsafe care environments. Repeat disappearances, for example, may highlight unresolved trauma. Systemic failures may facilitate repeated exposure to adults who may wish to criminally exploit children. And I know child criminal exploitation is not a normative binary, because that kind of division between perpetrator and victim is often over exaggerated, and that lots of times some children talk to their peers about opportunities for making money. However, there's always power dynamics involved in those kinds of relations. And what I'm suggesting is that missing often marks a critical entry point into exploitation. And as professionals who are given responsibility for the care of children, this should be something that is to the fore of our practices. So if we move to the next slide. So trauma-related behaviors, loyalty to exploiters, resistance to authority, repeated absconding, these behaviors are often misinterpreted as defiance or agency, free choice, rather than looking into the deeper structuring structures of our care systems. And these behaviors may be seen as survival strategies. Many frontline professionals fail to recognize, and maybe this is something about undertraining in recognizing and responding to these behaviors appropriately. And I put an example there of survivor-informed safeguarding. And, you know, as professionals, we can learn a lot from people with lived experience. And some of the training that we have been developing is been supporting people to give their narrative, anonymized narratives, and then facilitating discussions, multi-agency discussions around those narratives, so that professionals can rehearse those difficult conversations, because multi-agency work involves lots of different priorities, and we'd all do well to walk in somebody else's moccasins, really. So looking at the commonalities of our differences, to put obviously children first. So if we move to the next slide, please. So I've talked about Davy Jones's community care stuff, and in 2016 he was talking about police responses and often blaming care staff. I think he talks about saying, why don't you lock the lock the doors, or something like that. And this highlights lots of contradictions in safeguarding. You know, it's the kind of human rights of agency versus the limits to these choices that young people make in terms of age appropriateness. If you move to the next slide, please. My own research has looked at multi-agency safeguarding in CCE, And there are coordination challenges with this. There are sometimes different in different areas that agencies may be missing. One agency prioritizes their agendas over another, often within multi-agency groups. Police often have a lot of power, which needs negotiating around ideas of local authority priorities, although both priorities should prioritize safeguarding. Um, there's sometimes inconsistent structures in terms of the partnerships, and sometimes you get safeguarding in just by geography. These inconsistencies often hinder effective safeguarding. So if we move to the next slide, please. There are examples of specialist services that may child may go missing, found in a different district, rather than the complexities of local accommodation and breakdown in communication. There are specialist responses. A rescue and response project I examined briefly supports young people at risk of county lines, but they were overwhelmed by referrals, and the local authorities that funded them were selective in terms of where they might be able to prioritize their rescue and response. So this alongside with these binary dyads of is the person a victim or a perpetrator, complicated the interventions, complicates a kind of trauma-informed approach to interventions with young people. If you move to the next slide, please. So there's always tensions between criminal justice and safeguarding approaches. Quite recently, we've been undertaking some work around early interventions, reflective practice, in fact, between police and CPS, where we've undertaken document elicitations around cases where they didn't go in the direction in which was expected. So, for example, where the police may have thought there was a clear case of criminal exploitation, prosecutions have gone down the line of possession with intent to supply, or where the police have thought that there was a clear safeguarding issue, the child's been prosecuted. And so we've been picking up some of these cases in one region and undertaking reflective practice with safeguarding professionals, police and CPS, looking at dual investigations when they come in contact with the criminal justice system, looking at the pinch points where the child may have been referred for safeguarding, looking at how evidence is presented to the CPS to fulfill full code tests and so forth. And practitioners have seemed to enjoy the opportunity for reflective practice. And we've been drafting some policy guidance on this, which is currently being examined, and I will inform the University of Cardiff if and when this is more available more widely. So if you move to the next slide, please. I mentioned that I mentioned Skeggs's work earlier, and the ideas of cultural capital not being as valued for particular groups, and the examples that we see in our practices and our research is the adultification, particularly of Black children, which increases criminalisation or the risk of criminalisation, as well as structural racism and sexism, which both intensify harm. So there is a kind of intersectionality that works against the interests of safeguarding children and young people. You move to the next slide, please. Yeah, I've undertaken the 22 project. I was able to reflect back to the COVID-19 lockdown, and respondents were talking about the changes in terms of networks of drug distribution, which became more localized. And in some of the sites that I looked at, there was a kind of franchising model that was beginning to emerge. One of the areas I looked at had been researched over 15 years by 3 different researchers, including myself. And that enabled us to see the development of drug dealing networks within one particular site. And one of the significant changes was a kind of franchising model that became more apparent during COVID-19, whereby the reputation of the main gang who was distributing, I hesitate with the G word, that was distributing Class A drugs was kind of passed down to more localized young people. So they would use the brand name, the line names, and the gang name. So missing episodes and those missing from care became shorter and more difficult to detect. But unfortunately, the exploitation continues. If you move to the next slide, please. And I'm cognizant of time, so I might try and catch up. So lack of oversight enables grooming and exploitation, and obviously in profit-driven care models, this perhaps is more increased because there's more likely chances of less qualified staff, less numbers of staff per cohort, but I can't verify that at the moment. I belong to a research group that's beginning to probe these kinds of questions. So if you move to the next slide, please. So if we see missing children as indicators of systemic failures, and that's not discounting culture and agency, but if we start to look and foreground systemic failures, we start to think about safeguarding in a child-first approach rather than victim blaming or providing a viewpoint of over self-perpetuated choices in illicit markets, let's put it that way. So what I'm suggesting is then that as we do, that criminologists, practitioners must advocate for reform and justice for these vulnerable groups. And if you move to the next slide, and the next one. And in doing so, as we advocate for children and better safeguarding, there are some possibilities in the future. We are expecting the Crime and Policing Bill in to be enacted in 2026, And this presents an opportunity, I hope, for a national action plan that will bring in better standards, which could lower thresholds for interventions, better standards for inspections, and so forth. I mean, this is my wishful thinking. Um, what we need to do certainly is follow Wales's example and abolish unregulated care placements in England. And I'm passionate about better training opportunities for frontline workers, often which are denied. Um, and what I would like to see is a national, well, there is a national missing children's strategy, but it's how we get from a um, a policy to a substantive change in implementation of this strategy. And one of the levers to do this is through more regular inspection thematics. We need better recognition of exploited children as victims. We need evidence-led advocacy for reform, and those reforms would be to promote fairer resource distribution to address the structural harms that I've spoken about today. I'm going to leave it there and I'll field some questions. Thank you.
Thank you very much. If anybody's got any questions, could you pop them into the chat box, please? But in the meantime, I wanted to just probe a little bit, Paul.
Yeah, go ahead.
You said a couple of times about we have some of our most vulnerable children being looked after by the sort of least qualified people.
Yeah.
And this resonates with some of the findings from some studies I was involved in quite a few years ago, that
Yeah.
Because it's generally the lower paid workers that can lead to a high turnover and difficulties, because you also talked about relational practice.
Yes.
So I was interested in what you whether you agree with the professionalisation of these staff and what you think that would look like in practice.
Yeah. I think there's an awful lot of good opportunities for people who genuinely have great skills around childcare, and then and concerns, genuine concerns and empathy for young people. And as an entry point, it's often the way for social work trainees to start in residential care was mine. Um, but those opportunities for training whilst in practice, those opportunities for reflections in and on practice for people to progress onto higher pay grades, and hopefully if there was a professionalisation of residential social work, or a greater professionalisation, this might bring about better paying conditions, which may attract people to remain in those kinds of environments where their skills, if developed, could be really impactful. And I'm hopeful around the advent of, it used to be day release for CSS, as I seem to recall. But I'm hopeful that the advent of smarter online systems of education where you can move through things at your own pace whilst still having quality supervision and still maintaining the standards of social work practice and educational need will provide those opportunities. I'm ever hopeful. Does that answer your question, Nina?
It does, and actually we've had a couple of comments about that as well. So one is about whether that should be a trauma-informed qualification.
Yeah.
And should it be overseen by social services, local authorities, colleges, universities? How would you
Yeah.
see that?
Well, I find all of this quite interesting because um, I mentioned kind of three broad layers of kind of structure, culture, and agency. And I think um, many years ago, there was a master's degree that was developed for youth justice and social work together. And it was rather novel for its day, but it had elements of lots of things that were needed at that particular time. And that time was the 90s, I think, when those were around. I think Charlie Burr was doing it in Camden. And there I think now there's a need for other skills, which is, yes, of course, it should include trauma-informed practices, but you also need to know why the politics of Jamaica was being fought out on the streets of northern cities in the at the turn of 2010, for example. What local aspects are we dealing with within these trauma-informed approaches? So it needs to be broad and focused, if you like, and the skills of criminology, youth work, and social work together, I think, would make a great opportunity to reduce the harms from child criminal exploitation.
Yeah, I mean, I was going to say about youth work. This is a really good point that's been made. Lots of third sector are very experienced. However, the pay is low, resulting in many leaving the profession, which
Yeah,
leads to less experienced workers on times. Higher pay trends tend to be through social services. However, many do not wish to work in this industry. And I
yeah,
think I would add to that as well that the third sectors, you talked about a really good project, and what we find in Wales is that they've got fixed term funding.
yes.
So I wondered about your thoughts about the inclusion of third sector professionals.
Yeah, well, my hopefulness for a national action plan with the new act that's coming next year, um, I think that there should be a more well, certainly longer term funding for the current marketization and competitiveness, where people are scratching around um, and competing with each other for short-term contracts. Lots of innovation and very good work is lost through this short-termism. I can understand why youth workers want to remain as youth workers because they have a relational freedom that's not afforded to others with young people, and that can be really effective. But if we start to think about what's happened to youth work in the last 15 years, I think you would find it quite disturbing the reductions in resources
Yeah.
around this. And even to get us back to a position of 15 years ago would take substantial commitments from government. And that's what I meant in those conclusions around a shift in social resources or a shift in resources towards social justice, really.
Okay, we've only got a couple of minutes left, so I'm going to ask people if they would mind completing the poll. But in the meantime, we've had a question. This is, I think, learning from one of our studies, and that's sometimes in children's homes or children in care, when they're late back to the residence, it's marked down as a missing episode rather than lateness,
Yeah,
and it's tremendously difficult to disaggregate that data. So
yeah.
what are your views about the recording of lateness as a missing episode?
Uh, I would I would suggest that it would it would be difficult to look at a national standard on this and to disaggregate. And I think this is where meaning comes in. This is where reflective practice comes in on how we might record lateness, intended missing, as opposed to escape, if you like. Yeah, we could subcategorize, but I think we need to get some baseline data first, and then we can develop in conversations with practitioners what kinds of categories of missing and what kind of skills to assess what kind of categories of missing and assessments of children that go missing might be pertinent. I don't feel as though I've answered that fully, and I would probably need to think a little bit more about that, if I'm honest.
That's wonderful. I mean, we're going to have to go now. We've got a minute left. I would just like to thank you very much for your time. It's been really interesting and thought-provoking. And thank you to everybody else who joined us today. And just a reminder about Sarah Goff's session on the 4th of November. Thank you very much.
Thank you.
Thanks, Paul.